we talk about breast cancer in young women now, which is a very important issue, especially in the MENA region and also in Egypt compared to the Western countries. And we mentioned that according to the statistics, it is now almost 13% in the breast cancer in young women in Egypt and 20% in the MENA region, while it is only 5% in the Western country. So it is a very important issue. It is not only because of the percentage, but because of we have different characteristics, including the social and the sexual and the functional differences. And because of this, it is important to look for and to try to help to know what is the differences between the young woman with breast cancer in the Egypt and in the Middle East, and also what is the difference between the and the outside. And there is a lot of literatures and a lot of research done to know exactly if there is a genomic difference between the Middle East and the higher. That we listed the company up, and we find that despite is a difference or like higher percentage Pakistan, the percentage of the BRCA1 and 2 may be lower, taken Egypt other than North Africa, rather than the South Europe. And we find that those who have family history, the probability of the BRCA1 and 2 is high. What is important is not only the BRCA1 and 2, but there is also other mutations, including the PALB and the TP1 hybrids. And so it is important also to know that the young woman with breast cancer has different challenges, including what is the type of the chemotherapy that they may go for. It is important to escalate and giving more intensive liquid or hot. It is important to go for intensive and when for LHRH for all cases or not. It is important to pass CBQ for 6 liters for other that. So it is important to tailor the guidelines and tailor the recommendation for risk cancer in young women, especially for the MENA region. So we decided to go for a document consensus accept alignment in the meeting that we go for some escalation and some patients who have early breast cancer land. So we can according also the response. So in breast cancer can with higher responsibly and on meta and supplication. And also it is we can go for limiting the administration and care to in patient with very early and small tumor and this cancer in young women with positive IC. This also raises a very important issue regarding the genomic assay, because in some countries we have with lack of information because we don't have the capacity of the genomics to depend on DKI67 a lot, and this is discussed. And yes, we can remove DKI67 and it is now orphan apply to what would be genomic coding to assess the your assessment of a genomic profiling in this breast cancer patient lab 1. And also it is important to know, according to the statistics meter, that we have a higher percentage of the head positivity. We have almost 40% compared to only 29% in authors. The also higher percentage of estrogen receptor negativity. So these differences making us point for a collaborative study into the Iraq region to assess the patient of breast cancer data. I hope that all the breast cancer patients, especially young, have because it must be discussed with multidisciplinary team approach. This helping to have an better hours. We started the 17th BGICC, the Breast Gynae International Cancer Conference, and this year is very different. So we have a lot of scientific and also international collaboration in this meeting. So we have almost like 150 international speakers, more than 4,000 attendees, and also more than 12 tracks of breast surgical oncology, medical oncology, radiation therapy, genomics, translation research, palliative care, and a lot of activities on all tracks. We have a lot of discussion and a lot of consensus statement that we will work on the breast cancer in young women, and also we go for the breast cancer in BRCA mutation carrier. So we go for a consensus statement that will be published very soon. And also we have, beside this, a lot of side meeting between the WHO and the Presidential Initiative for Women Health in Egypt, also integrated with other international societies like the ISGO, the ISMO, the ASCO, and the UICC, represented by higher authority. It is a very high level meeting that we go for, like announcement for Cairo Call to Action for supporting and fighting cancer. The Cairo Call for Action is announced by the World Health Organization in the EMRO region, and it is work will go for steps, very important steps in the fight against cancer. In the same line, we have today a very important meeting about announcing another important regional collaboration between all the Arab societies, also with collaboration with the IARC and the WHO and the ASCO and the ISMO, to go for collaboration and research and collaboration in education in the Arab region. And we decided to start with a project locally, going for an assessment of the genomics, that making the screening important to high risk population in the Arab countries, and what is the different characteristics between the breast cancer in Arab region different than the others, which is maybe the start of new assessment and new project and new treatment methodology. The third thing that we today we will sign a very big in the closing ceremony about the 35th year of Egyptian Cancer Society between China and Egypt, and it will be the between the Egyptian Cancer Society and the CACA, which is the Chinese Cancer Society. Also, we go for announcement about the media partnership between the OncoDaily and the Egyptian Cancer Society in the closing ceremony. We know that it is important to use the artificial intelligence and the data, and also the OncoDaily announcing how the social media affecting the oncology practice in the worldwide, and even the research activity. I hope that this BGICC in the 18th edition have all of you coming to Egypt to see the differences and to know more and more about Egypt.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.